essential exam, your board exams, or you're a resident nurse, you're doing any of the specialties, or you're even a practicing nurse and you just want to, upgrade your knowledge or update yourself on the everyday happenings in nursing, this is the channel for you. Do not go anywhere, stick and stay, and then let us go together. So kindly subscribe to this channel. It is very important. My name is Nurse Evie. I'm a registered nurse. I have been practicing in Ghana for over a decade now. I've been trained in Ghana actually, and I'm currently working in Ghana, the emergency unit to be specific. So I may be a little emergency biased sometimes, so please bear with me. So thank you very much once again for joining us on Smart Nursing, and let's get into the very first video. And so in this video we want to talk about a smart way in history taking, pain history taking for that matter. Now you need to understand that nursing or medicine or healthcare can be very abstract sometimes, and you need to experience some of the things you read in the book to be able to really understand and articulate with it. And so you need to come up with, there are a lot of mnemonics, there are a lot of acronyms, mnemonics in nursing that we use, and it helps a lot. And so a very smart way of learning, this is one of the tips I actually use. There's going to be another video where we'll talk about learning tips or study tips, things that you can do in order you to know that coming up with your own mnemonics when studying helps a lot. Now, without wasting much time, let us talk about a very smart way in pain history taking. Now, there are so many acronyms we use in history taking, especially when it comes to pain, and one of them is the SOCRATES. There's S, there's an O, there's a C, there's an R, an A, a T, E, and S. SOCRATES. Now, what does the S stand for? The S in SOCRATES stands for the site of the pain. The site of the pain. Why do you need to know the site of the pain? And first of all, how do you even elicit the site of the pain? How do you know where the patient is having, or which part of the body the patient has pain at? You first of all need to ask the patient to point to where exactly he or she is feeling the pain. The reason you do that is that sometimes you can encounter a patient who really doesn't understand your language or is finding it difficult to even understand what you're saying, even though you're speaking the same language. Now, that patient may be understanding your language. For an example, I'm an Ewe, the patient can be an Ewe, but at that particular time, maybe he's just not finding the words to tell you what or where the pain is. So the best thing to do is to ask the patient to point at where he or she is feeling the pain. Now, why is that necessary? Why is even that necessary? Somebody will ask, because after all, at the end of the day, if I am giving you something for the pain, regardless of where the pain is, I can give you any pain medication and analgesic, and then the pain goes off. But why is it important to know the site? It is very important to know the site because knowing where the pain is gives you an idea of what structures or what organs could be involved in this whole presentation or this pathology of the patient. For example, you know that in the abdomen, you can either have 4 quadrants or 9 regions, depending on how you want to divide the abdomen. And so having a pain, for example, in the right hypochondriac region could be giving you ideas of what could be going on there. What are the structures in the right hypochondriac region if you're going with the 9 regions, or you're even going with the 4 quadrants? We will talk about those extensively in another video, but what I am trying to let you know here is that knowing the site of the pain gives you an idea of what could be going on inside this body, or what organs or what structures could be involved in this presentation. Now let's move on to the O. The O in Socrates talks about the onset of the pain. About the onset of the pain. Now, what do you want to know about the onset? You want to know whether the pain has been gradual. Was it having a gradual onset or a rapid onset? What you mean by gradual onset is, did the pain start, on a milder tone and is climbing up, or all of a sudden it just started and it's so severe, or it started all of a sudden and it's dull, it started all of a sudden and it's piercing? It gives you an idea. There are conditions that manifest with rapid pain, and there are some that manifest with gradual pain. So you need to know how this patient's pain started. All right, and that brings us to C. Now at C, you want to know the character of the pain. The character of the pain. This is where you ask the patient to describe how you're feeling. Okay, you have a chest pain. You said it is behind your sternum because the patient pointed, somewhere here, and you're like, okay, so that may be behind your sternum, but how do you feel? How best can you describe this pain? You can go ahead and then give examples and ask the patient whether or not the pain is burning. Is it dull? Is it sharp? Is it piercing? Is it crashing? So you need to know or have an idea of the characteristics of the pain. And again, you need that to be able to form an impression or have an idea of what is going on, because disease conditions have some particular way of presenting with pain. And so you want to know whether the pain is crashing, the pain is dull, is sharp, whichever description the patient will give you is very important to know. Now let's move on to R, right? For R, it stands for radiation. R stands for radiation. So this pain you're feeling, Mr. V, does the pain go anywhere else? Do you feel the pain anywhere else, or it is just stagnant? Then again, it will give you an idea or help you to, have an impression of what is going on. There are some pains that have a particular pattern. For example, somebody with an appendicitis will probably start around the peri-umbilical region, and then it will move down and localize in the right inguinal region thereabout. And so you need to know if that pain radiates, or maybe it's a chest pain and it's radiating to the left arm, it's radiating to the back. Then you're thinking, maybe could this be angina? And so you need to know whether the pain radiates or it doesn't. Then we come to A, which is associations. And so you want to know whether this pain is associated with any other symptom. It could be vomiting, it could be dizziness, it could be diarrhea, it could be cough, it could be anything, it could be fever. So this pain you're feeling, does it come with any other things? She can tell you, well, when I feel this pain, I vomit. Or when I started feeling this pain, I had vomited 2 times already. And so it is very, very important to know whether the pain the patient is feeling is associated with any other symptoms. And now we've come to T, right? And so you want to know the timing. Now in timing, what you need to understand is whether the pain has been constant or it's colicky. Colicky here means does it go and come? In my local language, when you want to translate it literally, it means that is holding. Does the pain hold you? The patient will say, well, it holds me and then it stops. Then it holds me again and then it stops. That is a colicky pain. Or you want to know whether the pain has been constant. Has the pain been there since it came and it never went away? You need to know. You know, some pain, some, like I said, some conditions present in some particular way. All of its cause, you know, pain will probably present with a colicky nature. You know, you have renal colic and then you have urethral colic in you know, presenting in a colicky manner. And then you have these pains too that are very constant. You know, you can have angina that is crashing and it's just there, it's not going anywhere. Or you have this burning sensation and it's in your epigastric region and it's just stagnant. All right, all this will lead you to or towards an impression. And so it is very, very important to do this quick, you know, assessment using the SOCRATES during your pain history taken. Now let's talk about E, which is exacerbation. So the E here can either be for exacerbation or alleviating factors. Is there anything you do that worsens the case or worsens the pain, or is there something that you do that, you know, makes the pain better? That is what alleviation means. Some pain, you know, changes with position. And a very good example of such a pain is pericarditis. Pericarditis has a very nice way of presenting, you know, it changes with position. So the pain is positional, it's pleuritic, and it's tender. That is for pericarditis. We will talk about that in another video, but just to give you, you know, an idea that there are some pains that changes with position. And so when you get to A, you want to know whether there is any alleviating or there is any, you know, exacerbation. Some pain, you know, worsens with movement, and so you realize that the patient comes in, is in severe abdominal pain and is just coiled onto his or her bed and he doesn't want to move because any movement at all worsens the pain. And you can talk about peritonitis, you know, and probably some hollow viscous perforation. And so E is very is very, very important. All right, and now brings us to S, a very, very important one too, which is severity. Now in severity, you want to know how severe the pain is. There are so many ways to measure the severity of your patient's pain. It's a very common one that we all know and use is a number scale, which is the 0 to 10 grading, where you tell your patient that 0 is no pain, 5 is, you know, some pain that I can manage, and then 10 is the worst of all. And as you climb the ladder from 0 to 10, the pain increases, and then you ask the patient to tell you where they can place their pain, and then they give you a number, and it gives you the idea of the severity, whether it's mild, moderate, or severe. And so we've been talking about SOCRATES, and then we said that SOCRATES is a very smart way of taking pain history in your unit or wherever you are practicing. And then it also helps in emergencies, OPDs, or maybe you're doing your assessment on your ward and the patient tells you, well, I have developed this pain over the night. You really want to know the characteristics of the pain. You want to know the site first of all. You want to know the onset. You want to know the character, and you want to know whether the pain radiates or not. You also want to know whether there are any alleviating or exacerbating factors. You want to know the timing of the pain. And then you also want to know, you know, whether there is any exacerbation, but the severity of the pain. And so this brings us to the end of this video. We've been talking about pain history taking, and also a very smart way of picking salient information that will give you an idea of what pain or where the pain could be coming from for your patients. Once again, this has been Smart Nursing made very easy. And so we are pleading and asking that you kindly subscribe to our channel,